L&R USA Inc. is a global medical device and supplies company with a 160-year history of designing and manufacturing innovative compression therapy and advanced wound care products. As part of our commitment to provide the best possible compression therapy solutions, we have prepared this video demonstrating the measuring guidelines for L&R's TributeNight custom therapeutic nightwear compression garments, part of the Solaris collection of garments and wraps by L&R. All TributeNight garments are custom designed and fabricated for style and donning preferences. The measuring positions indicated on the order forms are for reference only. Use your professional judgment. The most appropriate measuring locations will vary depending on your patient's presentation. As you take each measurement, record it in the appropriate space on the order form as shown. And remember, all measurements are taken in centimeters. Since TributeNight garments are most commonly worn while the patient is sleeping, we recommend measurements be taken in a supine position. If necessary, measurements can be taken in standing or seated positions, but always indicate on the order form the position in which the measurements were taken. In extreme presentations, measure the lobules, breast, or pannus in a supported position. Note that when skin folds are present, measure the largest girth. Additionally, you may measure the circumference under the skin fold. If there is girth fluctuation, indicate the girth range on the form as shown. With the patient in a supine position and their arm lying next to the trunk, begin by marking the length of the arm. If needed, place a pencil or dowel in the armpit as a visual guide. You will use these marks later as a reference when measuring circumferences. With the palm up, measure from the digit crease, MCP, to the fingertip on the third digit, or middle finger, and record on the order form. Again with the palm up, measure from the digit crease of the third digit to the wrist crease, or determined 0 position, and record as B length. An additional measurement can be taken from the wrist crease, or 0 position, to the first digit web space, and record. Measure from the determined C position, or 0, to the largest circumference of the forearm, or determined D length, and record. With the elbow in slight 10 to 20 degree flexion, measure from the determined 0 position, C, to the medial elbow crease, or the determined E position, and record. Measure from the determined 0 position, C, to the largest circumference point of the upper arm, or determined F position, and record as F length. Measure from the determined 0 position, C, to the axilla, or determined G position, and record as G length. Determine the position of the acromioclavicular joint and mark. Then measure from lateral G length to the determined H position and record. Determine the position of the HPS, or high point shoulder, and mark. Then measure the I length from the acromioclavicular joint to the HPS, or base of neck, and record. Now measure and record circumferences at the determined positions, with the patient in a relaxed position. As an optional A measurement, measure the distal circumference of the hand in a relaxed position and record on the order form as shown. Next, measure the palm circumference across the metacarpal heads, or the determined B position, and record. To determine the C circumference, measure the wrist circumference over the styloids, or at the determined 0 position, and record. Measure the circumference of the forearm at the determined D position, and record on the order form. With the elbow in a slight 10 to 20 degree flexion, measure the circumference of the elbow at the determined E position. Use the medial elbow crease and mid-olecranon process as your reference points. Record as shown. Next, measure the circumference of the upper arm at the determined F position and record your measurement on the order form. The G circumference is measured at the axilla, or determined G position. Record your measurement on the form as shown. Now with the patient seated, measure the diagonal circumference, beginning at the anterior acromioclavicular joint to the opposing axilla, back to the posterior acromioclavicular joint, and record your measurement on the form. Your measurements are now complete. Next, you can choose to customize your garment further with modifications and design. At L&R, we are committed to helping your patients receive the full benefit from their 100% custom TributeNight garment. We hope this video has provided a user-friendly guideline for measuring with L&R's forms. Should you have any questions regarding a custom design or selecting a style of compression garment for your patient's individual therapeutic needs, our Design Center team is ready to help and available by phone, email, or video conferencing. Thank you for your continued business and for choosing L&R USA Inc.